Good day, Miss. I'm Gwyneth Carlos from BSN3A Newman. Today I'm going to perform the procedure perineal care. As defined, this is the septic cleansing of the vulva and the perineum. In doing this procedure, first we need to review the general assessment data about the patient, observe for signs of perineal itching, burning on urination, or skin irritation, and ask the patient if he or she is experiencing any of these problems. Next is to assess patient's ability to bath him or herself to perform perineal care. Next is assess patient's learning needs related to perineal care. While providing privacy, assess the perineal or genital area for abnormalities. The perineal care is to keep the vulva and perineum clean, to promote healing of perineal wound, to prevent infection, and to prevent disagreeable odor, and to provide comfort for the patient. General considerations includes the flushing water should be at the right temperature to avoid burning the patient. Observe special care when a patient has a perineal wound or stitches to avoid much discomfort. If the patient defecated or voided, empty the bedpan first before giving perineal care. And lastly is to discard used perineal balls into the waste receptacle and not into the bedpan. For the preparation, we need to prepare necessary equipments to proceed with the procedure. First, our flushing tray would contain the following: pack of dry perineal balls, bottle of sterile soap sod solution, flushing pitcher with warm sterile water, pickup forceps soaked in Sidex solution, and extra sterile forceps. Other equipments needed are waste receptacle, preferably a Mrs. basin lined with paper, ordered medicine, tissue paper, rubber protector if needed, bedpan, perineal pad also if necessary, and bath towel and gloves. In getting the patient ready for the procedure, we also need to do three things first. First is to explain the procedure and its purpose, screen the patient, then remove perineal pad if there is, wrap it with paper and discard into the waste can. Okay. First procedure is to loosen the foot part of the top sheet and place patient in a dorsal recumbent position. This position allows the patient to lift herself onto the bedpan. So ma'am, can you please raise your legs? So assuming that the patient is now in a dorsal recumbent position, place rubber protector against patient's buttocks to protect the beddings from getting wet. Next is to place the patient on a bedpan. Then fan fold the top sheet towards the knees to expose the vulva and perineum. Put a bath towel over the patient's abdomen. Providing privacy avoids overexposure. Bath towel protects the gown from soilage. Before cleaning the vulva, we need to rinse off urine, fecal and vaginal drainage using warm water. So we're going to pour sterile water over the vulva because warm water helps in relaxation of nerve endings. Now it's time to clean the vulva. Then we will clean the vulva and perineum using perineal balls soaked in solution. Remember to use a downward stroke in cleaning the vulva. Contamination from the rectal area is prevented by using a downward stroke. going to start cleaning with the center of the vulva because cleansing an area where there are few organisms before cleansing one with numerous organisms minimizes the spread of organisms to cleaner areas. First is the center of the vulva, then discard. Next is farther labia minora, discard. Then the center of the vulva going to the mons pubis, use a fresh perineal balls for each stroke. Repeat sequence of cleansing as necessary. Next is to rinse the area with warm water. See to it that the solution is completely rinsed out. Soap that is left on the skin and mucous membrane may cause irritation. Then, dry vulva and perineum with dry perineal balls following the same sequence in the cleansing. In drying the vulva, this would enhance patient's comfort. Wet or moist environment cultures bacterial growth. Now that our perineal area is dry, next thing to do is to remove bedpan and turn patient near to you. This position makes it easy to dry buttocks in the anus. Working close to an object prevents overstretching, which may cause muscle strain. Then dry buttocks in the anus using tissue paper as a mechanical means helps in drying the skin. Assist patient to assume a dorsal recumbent position. This prompts attention to details of patient's comfort and confidence. Also apply medication as ordered and perineal pad if necessary. Discharges from perineal area are absorbed by the perineal pad. Then, remove the bed protector then arrange the bedding to make the patient comfortable. An orderly environment is conducive to health and keeps the unit clean and neat. After doing the procedure, the nurse must evaluate if the perineal care has been comfortably and effectively provided and if perineal area is clean and odor-free.